Hello, I'm Dr. Brian Haas. I want to take a few minutes and go over some of my highlights from my peripheral neuropathy seminar. But first, I'd like to share with you and have you watch some recent testimonials from patients of mine that suffered from peripheral neuropathy and received amazing results in our office and are very happy with the care they received in our office. We'll talk to you in a few minutes.
Hello, my name is Evie Stafford. My original problem was I had neuropathy in both feet that affected my whole life in the sense that I couldn't walk at all. At days when I had to do something, I couldn't do it because I had to sit down and put my feet up. I just couldn't walk. So it was also very painful. There were nights that I was sitting in my recliner because I had shooting pain every few seconds going through my whole left leg especially. And I saw in the newspaper from Dr. Haas that he specializes in neuropathy pain. So I called him and asked him if he thought he could help me. And so we set up an appointment and I came in and we talked, and his feelings were that he really could help me. So here I started my therapy, and actually and it sounds crazy, but from the first day on that I had the treatment, when I came home, I said to my husband, my feet somehow don't burn today. And it leads me to believe that the therapy is really, really helping my feet. Now I'm up to walking with my husband, my dog, which is actually hiking. We're living in a mountain up to 3 miles a day, which is something unheard of at least 2 years ago. I couldn't even go to the post office, if you will. And my whole life has changed to the fact that I'm mobile again. The staff here in the Wellness Center is absolutely outstanding. They are very happy, very nice, very helpful, and I'm actually looking forward for Wednesday morning to come down here. And I come down from the mountain, which is an hour-and-a-half drive, but it's worth the time to come down here, and it's worth every penny that it costs. And I personally have recommended Dr. Haas to 4 people up there in the mountain where I live, and I hope they will call soon that they are also being helped. Thank you very much.
My name is Richard Larson. My original problems had to do with an accident that I had with my feet about 2.5 years ago. I had hairline fractures in most of my toes. Both ankles were sprained. Bottoms of the feet were in serious pain. It took me about several months to get over the pain, but I still had problems walking. I had pain when I walked, even with Dr. Scholl inserts in my shoes. I had pain when I walked until I came to the Wellness Institute. It affected my life very severely because I really couldn't exercise. I live in the Santa Monica Mountains, and I was hiking the Santa Monica Mountains. All of a sudden I couldn't do that anymore. So my exercise was cut way, way back. I gained a little weight around my tummy, and that was not fun. What was it like at the worst? I happened to be in London. It was cold, and I had been walking in street shoes, and at the end of the day I could not walk, period. I had to sit in the bathtub, warm up my feet, try to get some circulation back, and I did that for several days, and then I was able to walk again. But for a while I wasn't able to walk at all. Everything has changed since I've been at the Wellness Institute. Through vibrations, through massages, through I think it's electromagnetic impulses, I now can walk on my hardwood floors in my bare feet with no pain whatsoever. Walk around the pool. I'm back hiking in the mountains again. It's absolutely terrific. It was about twice a week, a little more than an hour, twice a week for 6 months, and I'm completely cured. It's absolutely terrific. Dr. Haas has been absolutely wonderful. He takes the time with me and with everybody else, works his butt off. The staff is friendly. There's good music. It's a nice place to be. It's a terrific experience. And would I refer friends and family to Dr. Haas? Absolutely. This place is terrific.
Welcome back. Now I want to talk about peripheral neuropathy. You know, some of you are watching this video because obviously you suffer from neuropathy or peripheral neuropathy, and maybe you've been down the traditional medical route where you're taking medications, you're taking Neurontin, you're taking a whole list actually of different medications and are not seeing results that you want and are expecting. Actually, maybe some of you have even gotten worse over time, where you've got more burning, more pain, more numbness, more tingling, and maybe it's gotten to the point where it's caused you where you can't walk very good, you're in excruciating pain. Some of you may even have are at the point where you're debilitated, where you have to have somebody drive you, and a condition is at a severe point and it's affecting your life. Well, I'm here to tell you folks that never to give up hope. There's always hope, and I'm going to go over neuropathy and what are the causes, some of the treatments, and how you can benefit from the treatment programs we have in our office. So peripheral neuropathy is simply a condition of the nerves in your extremities, in your hands, in your feet, and it's those outer nerves that are affected from the brain down to the spinal cord, out into your hands, into your feet there. And this can cause pain, it can cause loss of motion, and cause numbness, tingling like we said, and it can be a severe debilitating condition that can progress over time. That's mostly what happens. Okay, so peripheral just means outer, meaning from your outer body, from the center of your core, from the brain and spinal cord, out to your hands or to your feet. Neuro means nerves. Pathy means abnormal. So it's an abnormal condition of the nerves that extend into your hands and your feet. It's very simple. Okay, there's 7 major signs of peripheral neuropathy. The first one is numbness, and this is a very common thing that when patients that come to my office, they experience some temporary or intermittent numbness that they have, maybe in their hands, maybe it's in their feet, and they get it from time to time. And sometimes that will extend into a burning sensation, especially in the feet and especially at night. Some of you may have that, where you're experiencing, you're trying to sleep at night and your feet are just on fire, like the hot coals are attached to your feet and you're not allowing you to sleep, and your feet are just burning so bad. This is very common as well. As the condition progresses, it can even extend into the muscles, where the cramping occurs in your muscles, especially in the calf, like this picture here shows. We have to grab your calf, the muscles start to become achy, they become painful, they're cramping, and then even a sharp electrical pain. You might get a shooting, stabbing-like pain in your hands or your feet. Again, that's very common as the condition progresses over time. And then what we see over the years or months, as the condition gets worse, patients have difficulty even walking. Even taking a step, one step at a time, causes excruciating pain. We were to the point where you have a cane that you use, or using a walker just to get around, because your pain is so devastating, it's so intense. Again, difficulty sleeping at night is a common thing, is a common symptom that patients have. Numbness, tingling, prickling sensations, again, is another symptom that patients have in the hands and feet. And we're going to talk about the 3 types of nerves in a few minutes. Welcome back, folks. I'm going to continue on by talking about the 3 types of nerves that become damaged with someone that has peripheral neuropathy. The first is the most common, and that's the sensory. The sensory nerves are the nerves that carry sensations. And we'll talk about what happens when those nerves do become damaged. Motor is the motor nerves. Those are affected muscles. So when those nerves become damaged, your muscles become affected. Finally, we have what are called autonomic nerves. So the autonomic nerves, we're going to talk about, controls the organs, tissues, glands, blood vessels. So tissue saturation, where there's decreased blood supply to your hands or your feet, decreased blood supply and oxygen. Those are from the autonomic nerves that can be damaged or affected from peripheral neuropathy. With sensory nerves, these are the most common symptoms we see with patients that are suffering from peripheral neuropathy. When there's changes or damage done to these nerves, you're going to have burning sensations, nerve pain. There could be joint problems, tingling, numbness, inability to walk properly because the joints become damaged or the feet become so numb or so tingling at the bottom of your feet. Some people some patients describe it as cardboard. When they're walking, they feel like they're walking on cardboard. They can't even feel their feet, which causes problems. So it causes their ability to walk properly becomes affected. And this progresses over time, and as this occurs, one of the most common symptoms, or one of the most common diseases that causes damage to the sensory nerves is diabetes, and we're going to talk about that in a few more minutes. Another motor nerves are the other type of nerves that become damaged. When this happens, patients have, again, muscle weakness, they have cramping, their legs, especially in their calves or in even their quads, their legs become very weak. They start to become atrophy, where they start to shrivel up, and patients don't have the strength to walk upstairs or even to hold their own body weight as these nerves become damaged. And then other muscles will then also become damaged over time. And these symptoms are difficulty breathing, difficulty swallowing. This can occur, inability to move different body parts. They become almost like a paralysis type of situation with some patients. Falling. Folks, this is huge. When these nerves become damaged, falls are very frequent. You're very susceptible and vulnerable to falling. And as you know, as you get in your 50s, 60s, and 70s, it's the fall, injuring yourself, breaking a hip, that leads to severe problems and complications, ending up in the hospital, ending up with pneumonia, even death. So the falls and hitting the head, that's the biggest thing as doctors that we're concerned about with the damage done to the motor and really the sensory nerves as well. Lack of dexterity. This is where you can't button your pants or your button coat or your shirt, and you don't have those fine motor skills like you used to. This is very common as well. Loss of muscle control. Again, very shaky. You can't hold a cup of coffee. Your hand starts to shake. That's common. Your handwriting becomes very difficult, and you can't even read your own handwriting anymore. Again, this happens. And again, like we talked about, muscle atrophy, where the actual muscle starts to die and shrink and becomes atrophied. Finally, there's muscle twitching or cramping. Again, at night, this mainly happens at night when the muscle starts to cramp there. Welcome back, folks. Now we're going to talk about the causes of peripheral neuropathy. There is literally a whole host of different causes that can lead to peripheral neuropathy. And to be honest with you folks, it's normally a condition that progresses over time. This is something that does not develop over a couple of weeks or a couple of months. It usually takes several years to progress to the point where you have peripheral neuropathy symptoms. One of the first causes, as we look at, is arthritis. Arthritis done to, maybe damage that's done to the hands, to the feet, to the joints, to the muscles maybe, and even the nerves due to a fall, a car accident, or an injury, or just a rheumatoid arthritis that's progressed over time too can lead to neuropathy type symptoms. Spinal stenosis. This is where the spinal cord has been compressed. It's smaller and much more narrow, and that compression of the spinal cord compresses on the nerves that lead into your hands or maybe your feet. It leads to the numbness, tingling, burning sensation that you may be suffering with. Again, bulging disc is very similar. It's a part of the disc that's herniated or bulging out, pressing on the spinal nerve, and those nerves that are being compressed are maybe going to your feet or to your hands, again leading to the numbness, tingling, the burning, the aching, the pain that you might be experiencing. Here's a big one, folks, that many of you don't know about, is statin drugs. Statin drugs is a major factor for causing peripheral neuropathy that you may not even know about, okay? Talk to your doctor about this. So cholesterol reducing drugs, the statins, The studies show, and we're going to go over the study in a few minutes, that is a major component, major factor for causing, contributing to neuropathy type symptoms. So definitely discuss that with your doctor. Diabetes, both type 1 and type 2, again with different fluctuating blood sugar levels, being too high or too low, that is a major factor for causing neuropathy type symptoms that we go over in more detail in the office here. Poor diet, of course, can lead to that, where you're eating too much sugars, too much simple carbohydrates, is a contributing factor. Genetics, of course, is a factor. We talk about genetics. Chemotherapy, folks. Some of you are on chemotherapy medications or drugs. That is a huge factor. We see this all the time in our office, that chemotherapy type of drugs can lead to and cause neuropathy type symptoms and cause it to progress. Chemical exposure. We're exposed to chemicals in our environment constantly, and this can lead to and progress neuropathy type symptoms as well. Like we talked about in a few minutes ago, the statin drugs. Statins inhibit the formation of cholesterol. Cholesterol is used in the synthesis of coenzyme Q10. Coenzyme Q10 is responsible for the formation development of ATP. ATP, folks, is the energy that your cells, every cell, needs, especially your nerves, are the most vulnerable, susceptible to a decreased production of ATP. And if you're on a statin drug, that's going to reduce that. And as we get older, in our 40s, 50s, and 60s, our body's ability to make ATP substantially decreases over time there. So some patients need to take some vitamins or take coenzyme Q10 to offset the statin drugs that they're taking. So that's a major factor there with neuropathy. And here's a study in the journal Neurology Journal, May 2002, says that the statin or cholesterol drugs increase the risk of peripheral neuropathy by 16 times. That's 1,600% increase of peripheral neuropathy symptoms or the disease. See, again, it blocks the coenzyme Q pathway, and it says here, from the study, statins increase the risk of polyneuropathy nerve damage from 1,600% to 4,500%. Folks, that is incredible, and that's something we really have to look at and we go over in the office. Diabetes, okay, we talked about diabetes. There's three main types of diabetes. Diabetes is a chronic metabolic condition in which the body cannot metabolize carbohydrates, fats, and proteins because of lack or ineffective use of your body's of the use of the hormone insulin. Okay, we talk about that. 60 to 70% of diabetics have some form of peripheral neuropathy. That might be you. You might be experiencing neuropathy type symptoms from your diabetic condition there. We go over this in the office. Again, there's three types: type 1, type 2, and gestational diabetes. Okay, and again, it causes the hypoglycemia or the insulin resistance, where you have shaking, hunger, sweating, heartbeat change, different change in mood. You might get fatigued after meals. You might have energy right after you eat a carbohydrate meal. That's a sign or symptom of a diabetic type of condition. Autoimmunity, folks. This is a huge factor that most of you haven't even been tested for. An autoimmune condition where the peripheral neuropathy is a result of an autoimmune disease where your own immune system, folks, your own body is attacking your own nerve tissue, causing, destroying the damage to the nerves, progressing your neuropathy type of condition or disease even further. There's tests that we do in our office to determine whether or not you have this type of condition, where it's an autoimmune type of condition. Again, it's a hidden cause. So most of you don't even know about it. It's a hidden cause of neuropathy, which is an autoimmune condition. We do the testing in the office for that. Welcome back, folks. Now, here's the thing in our office. This is what I want you to pay attention to. This is what makes our office different to maybe the other doctors you've seen in our office. We leave no stone unturned to find the exact cause of your neuropathy. And one of the ways we do this is to look at a complete metabolic panel, which consists of obviously your blood sugar profile. It includes hemoglobin A1C. Most of you have never even had this test done. It's the most accurate way to test to see if you have a blood sugar issue or a diabetic type of condition. Hemoglobin A1C. We look at your vitamin D levels to see how well your immune system is working. So that is huge. Anemias. Anemias is where there's not enough oxygen that's carried to the cells. Remember that oxygen is needed to the cells, especially the nerve cells. So we look and see if you have any anemias, iron deficiency, folic acid, B12 anemias in our office here. We look at kidney, liver, pancreas function. We also look at what's called flexing matrix. This is looking at your cortisol levels. Cortisol levels are too high or too low can affect blood sugar. As we talked about, too high or too low blood sugar levels can affect neuropathy and cause neuropathy type condition to become worse. We look at, this is the big one, folks, that most of your doctors have not checked yet, is immune panels. We check and see if your immune system is balanced. There needs to be a balance in your immune system. We look at all the nerve tissue antibodies to see if you have an autoimmune type of condition that's attacking your own nerves, leading to and causing your neuropathy type of symptoms that's maybe progressed over the years. This is a big test that we do. It's a very important test we do in this office that you most likely have not had yet. We look and we do a look and see if you have any chronic bacteria, yeast, fungal, even parasite infection. Folks, if you have an underlying infection going on, again, that's going to tax your immune system. The immune system can then drive inflammation. That inflammation is going to destroy more nerve tissue. So it's the inflammation that destroys the nerve tissue, all because you've had a chronic infection in your gut or intestines over the years. So we look for that. We also look for, folks, food sensitivities. Some of you maybe are allergic to or have food allergies that you could be fighting off or you could be inducing into your system. The 5 big ones are gluten, soy, yeast, egg, and casein, which is dairy. We test you for that, so this is a big possibility there. Welcome back, folks. You know, our office is very unique and is very different compared to other offices, and we look at it in a multifactorial approach here. See, we don't just cover up your symptoms and hope that your problem goes away with giving you a medication. We look at different aspects of neurological side and metabolic side. We're going to go over and find out the exact cause of your peripheral neuropathy condition. See, we look at the neurological side. We do all the neurological tests here in our office. Maybe even some of the tests that maybe your neurologist that you've seen haven't done yet. So we do all the tests to find out what's going on the neurological side. But folks, if you're just seeing a neurologist, they're missing the metabolic side. So we do and look at, like we talked about in the previous slides, in a few minutes, the previous slide is looking at the metabolic test. And we go through and look at all the different possibilities of metabolic that can go on with you, as along with neurologically, okay? So it's a neurological and metabolic workup, a complete workup there. Again, like we said earlier, we will not leave any stone unturned to find the exact cause of your neuropathy. Welcome back, folks. You know, I want to get into, you know, the treatment and how our office is unique in that way. Again, we look at both the metabolic side and the neurological components to help treat your peripheral neuropathy. Here in our office, we have a very unique, cutting-edge, comprehensive protocol that is structured in a way that's FDA approved to help treat your neuropathy. The technology is advanced and we see tremendous results in our office. And I gotta say, folks, that if I accept you as a patient in our office, that means I can help you. I don't accept everyone in our office, just to let you know. But if I can accept you, you are gonna get better, okay? We talked about before that you could have chronic underlying infections that's causing chronic inflammation in your intestines or in your system, leading to peripheral neuropathy. So we addressed those issues. We talked about blood sugar issues, both hypoglycemia, insulin resistance, diabetes. We look at what's driving that and what's causing your peripheral neuropathy symptoms from those issues. We look at adrenal problems that's creating cortisol problems, again, leading to increased inflammation. We address adrenal problems. We look at brain neurotransmitter. There's different components and different chemicals in the brain causing the brain to dysfunction. And those different components of the brain can actually contribute to and cause your neuropathy type symptoms. We look at that and we address those in the exam and see if you have those issues. Restore gut lining. Sometimes there's damage been done to the gut or the intestinal tract there, again, causing destruction, causing immune systems issues, leading to and even creating an autoimmune type of problem we addressed and talked about earlier, where your own immune system is destroying and attacking your own nerves in your hands or your feet or even in your legs. We address those issues and those protocols. Folks, it's at this point now you need to really ask yourself. You need to ask yourself this question: how serious are you in making a change? Okay, some of you have been suffering for many years, even decades, with your peripheral neuropathy condition, to the point where maybe you can't even get out of bed and you have so much pain in your feet that you can barely walk across the floor. You need a cane or a walker just to get through your house. You can't enjoy the activities that you used to do. Maybe you can't play tennis or exercise or walk on the treadmill. Maybe you've lost sleep. Well, you can't even sleep at night without waking up and your feet are on fire and they're burning. Folks, this is devastating. It's affected many thousands, if not millions of people's lives throughout the country. I'm here to say that there is hope. We can help you. It's time to make a change, and you need to do that. You need to sit down and figure out that a change needs to be made, and that can only come from you. So you need to ask yourself, are you ready to make this change? Call our office here at 818-249-2300 to set up a free consultation in our office. You can go to my website to find out more information about this seminar and how we treat peripheral neuropathy. Go to Glendale neuropathydoctor.com. I wish you all the best. I hope that you recover from your condition, and hopefully one day I can meet you and you'll be on your way to better health and happiness. Thank you.